Hello, everyone. Good morning. It is 10 o'clock sharp, so as we committed to do so, we will be getting started. My name is Melissa McVie. I am the Director of Education and Communications with the Ontario Association of Residents' Councils, OARC for short. You might know us more readily by that acronym. And today, we are so pleased to be hosting guests from the Ministry of Long-Term Care on our Zoom platform to provide this information session for residents. The content of today's session has been tailored to our intended audience of residents. We really do welcome any supportive partners of residents that are attending today, especially those that are supporting resident engagement in the session. Wherever possible, we will be prioritizing resident questions to ensure that residents get the most out of our time together. Today's session is being recorded, but I will assure you that a copy of this recording will be available, as well as the presentation slides following our time together. They will be posted on the OARC website for your convenience. This information session, you'll see that you've been muted. We're in listen-only mode, and we've done this in an effort to really minimize any background noise or distraction for our guest speakers. We've got a panel of great speakers with us today. We have protected the second half, so about 30 minutes for questions. This is your dedicated time to ask questions based on the material you're hearing today. We will also be incorporating a number of the questions that we received during your registration, so thank you for those who did submit questions in advance. I would like to start our session by taking a few moments for a land acknowledgement. Together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we are on today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations, and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. Thank you. Now, at this time, I'd like to give a warm welcome to our ministry guests, beginning with Lori Coleman. Lori is the director of the Long-Term Care Response Branch, which is part of the Long-Term Care Policy Division at the Ministry of Long-Term Care. So welcome, Lori. We look forward to starting today's session.
Thanks very much, Melissa. Good morning, everybody, and a very warm welcome to everyone that's joining the call today. I really want to thank you all for taking the time to join us for the information session today. It's always extremely humbling for my colleagues and I at the ministry to connect directly with residents. And we're certainly conscious that the changes made to rules and regulations ultimately affect how all of you experience life in your home. So again, we're appreciative of your time today. I also really wanted to take some time to thank our partners at the Ontario Association of Residents' Councils, Melissa, to you and your colleagues who've provided us with enormous support in preparing for today's gathering. So again, my name's Lori Coleman, and I work with the Policy Division at the Ministry of Long-Term Care. And I'm here with a number of my colleagues today to share some updates and to talk about what impact this will have in the homes in which you live. We certainly value your perspective and we want to hear from you. So we've saved lots of time at the end of our prepared presentation to respond to questions. Now, some of you have submitted questions in advance, which has been really helpful. It's helping us to make sure that we are answering the questions that are relevant to you. But we also have got the Q&A feature enabled for the presentation today. So if you have questions, please type them into the Zoom Q&A portion. We're going to do our very best to answer those at the end of the presentation. So again, why we're here today, we wanted to connect with you today because we're cognizant that the fall and winter seasons are when cases of respiratory illness typically increase. And this, along with the presence of COVID-19, is expected to put further strain on our hospitals and on our long-term care homes. You might have seen that the government is implementing a plan that is taking action to make sure that we're ready and that people can get the right care in the right place. So today we want to talk about a few different things. First, we want to share some information about Ontario's plan to stay open, and in particular, the health system stability and recovery and its connection to long-term care. We want to take an opportunity to provide you with updates on the new COVID-19 booster dose and to share information on the new ministry supports that are available for residents and homes. We are going to delve into more information about what the portion of the plan to stay open and how it relates to providing the right care in the right place, and what that means to residents and what they might expect. And lastly, as I mentioned earlier, we're going to take time to answer your questions and to really listen to your perspective and your comments. So with that, we'll move to the next slide, please. The province has developed a new plan to help keep our healthcare system working. And it has 5 main components to it. It has a portion that speaks to preserving our hospital capacity through the prevention of respiratory illness. And this can be achieved primarily by ensuring that Ontarians, including all of us, including residents, are up to date with their vaccinations. Secondly, the plan speaks about providing the right care in the right place by connecting patients, seniors, residents to the most appropriate care and reducing the number of emergency department visits. The third portion speaks to further reducing surgical wait lists through the province's surgical recovery strategy. Next, the fourth component is about easing pressure on emergency departments by supporting hospital doors to stay open and improve access to primary care. And lastly, the plan speaks about further expanding Ontario's health workforce by investing in healthcare professionals and providing them with the resources, support, and guidance they need to continue providing better care. There's been lots of questions and discussions about this new plan, specifically when it comes to ensuring the right care in the right place. We are going to spend time talking about this more later in the presentation, including the legislative change under Bill 7 that's designed to support patients who do not need hospital treatment by transferring them to long-term care homes. This legislative change not only aims to improve our hospital's capacity to provide urgent and surgical care, it will provide alternate level of care patients in hospitals with an opportunity to experience a better quality of life while waiting for a preferred long-term care home. This new law will come into force tomorrow, and this information session will further explain what this means for you and your loved ones. But before I do that, I'm going to pass the presentation over to Christine Luero, a director with the Long-Term Care Projects and Recovery within the Operations Division at the Ministry of Long-Term Care, to talk to us a little bit more about the COVID-19 Bivalent Booster. So Christine, over to you.
Thank you, Lori. Good morning, everyone. As Lori mentioned, my name is Christine Loureiro, and I'm one of the directors in the Long-Term Care Operations Division, and I've been supporting a pandemic response over the past several months. So I'm here today to talk to you about the Bivalent Booster. As Lori mentioned in her opening remarks, the fall season is upon us, the flu season, and add to that COVID-19. So we've been working over the past few months to make sure that homes are prepared for that fall season, such as sharing tools with them to support them to be prepared to respond to any outbreaks. Part of that fall plan also includes us working with the Office of the Chief Medical Officer of Health to determine what the right measures are to be in place at this point in the pandemic. So while I don't have any updates to share on that front today with you, if and when we do have updates to those measures, we would be happy to come back and do another webinar with you. The other key pieces to that fall preparedness plan is having access to antivirals and therapeutics, as well as access to the most up-to-date vaccines, which for our purposes today is the main thing I wanted to talk to you about, the COVID-19 bivalent booster. So just last week, the government announced the rollout of the bivalent booster. It's now available to residents, caregivers, and staff in long-term care homes. In general, it's recommended to get the booster 6 months after your last dose, but you can get it as early as 3 months after your last dose. And we encourage you to speak to your treating clinician about what's best for you. Your home will be supporting with on-site vaccination clinics, so you can get your booster in your home. Some homes might even open this up to your caregivers. So, you may contact your home to find out if that's available for your caregivers as well. Your caregivers also will have access to the booster in community settings such as pharmacies or in other vaccine clinics. Next slide, please. So the bivalent booster is one that targets both the original COVID-19 virus as well as the newer Omicron variant. And it's been this Omicron variant that's been predominantly circulating in Ontario and Canada since last December. So this bivalent booster has been found to be more effective against against this new Omicron variant than the previous vaccine. Getting the booster. So we know many residents received their last dose, over 6 months ago. We rolled out the 4th doses back in kind of January, late December, January. So many residents are now experiencing some waning immunity because it's been a long time since that last booster. So we do encourage everyone to get up to date and get the bivalent booster to help protect against symptomatic infection and against severe illness. That will help, restore, the booster will help restore that protection and, protect some of the progress we've made as, in long-term care as well as in the province. One other note as well is that you should also be seeing the rollout of the flu vaccine in the coming weeks. The flu vaccine can be administered at the same time as the COVID-19 booster. But they don't have to be at the same time either. One can follow or the other. So also just encouraging everyone to get up to date with their flu vaccine, as well as we do anticipate this year to see more flu going around than we have in the past couple of years. Okay, with that, I think I am turning it over to my colleague, Abby, from the Funding and Programs branch.
Morning, I'm Abby Dwash. I'm the Director of the Funding and Programs branch. I just wanted to talk a bit about some of the additional supports that the ministry is providing to go along with this new initiative. We have expanded supports for a number of things. One is increasing funding for specialized behavioral supports for residents. Another is providing additional funding to the virtual behavior medicine program led by Baycrest Hospital. And the third is to create a new local priorities fund to help long-term care homes support residents with complex care needs. I'll now turn it over to my colleague, Anita.
Thank you, Abby. Good morning, everybody. My name is Anita Hooper, and I am a director in the Ministry of Long-Term Care's Operations Division. And so in addition to the COVID-19 measures that Christine spoke about and Abby talked about the expanded funding supports the ministry is also making or has made some related policy changes that I'm just going to talk about quickly. So we are reopening or have reopened respite care and the short stay convalescent care program beds. So long-term care homes that had these short stay beds that were closed at the beginning of the pandemic are now able to reopen them for community respite care or short stays for people who are in the hospital who aren't yet ready to return home, who need a level of care, but not hospital level care. So homes who had these beds previously will work with Ontario Health to decide whether they would like to reopen these beds now or in the future. The other thing, the other policy change is that we are increasing the number of available beds in the home. So early in the pandemic, the public health advice was to have a number of beds kept vacant so they could be used to isolate people with COVID-19. So long-term care residents, as you know, have a very high rate of vaccination, as do staff and caregivers. And the ministry has updated the requirements related to emergency planning, including those related to respiratory outbreaks that would include things like COVID. And so it no longer requires homes to keep beds vacant for isolation. Homes have to have plans in case there is some kind of respiratory outbreak, but they don't necessarily have to have beds that are without residents in them, without long stay residents. So those are some changes that have been made, and you will see some changes over the coming months related to that. And just wanted to remind people that the ministry is continuing to increase the number of staffing hours for direct resident care. So there was a $4.9 billion investment to hire more than 27,000 long-term care staff over the next 4 years, starting in actually last year, 21-22. And this is to help ensure residents receive an average of 4 hours of direct care per resident per day by March 31st, 2025. So with that, I am going to pass things over to Emily Cohen-Henry, who is from our policy division.
Thank you very much, Anita. So my name is Emily Cohen-Henry, and I'm the manager of policy in the policy division here at the Ministry of Long-Term Care. Earlier, you heard from Lori about our broader plan to reopen, which included 5 areas of focus. I'm going to talk to you a bit more about the second area, which is the providing the right care in the right place. This area aims to connect people to the most appropriate care settings while preserving our hospital capacity for those who need it. It includes adding the new supports and services you heard about earlier and helping people to access the right care and the right services that meet their needs. What does this mean for people who are in hospital but who no longer need hospital care? A hospital is not always the appropriate care setting for a patient, nor is it a home. A patient is designated as needing an alternate level of care or as an ALC patient when, in the opinion of their attending clinician, they no longer require the intense resources or services provided in a hospital. In these cases, their care needs can be better met in an alternate care setting. For many ALC patients who no longer need hospital level care, a long-term care home is a more appropriate care setting. For these patients, long-term care homes can provide a better quality of life. They offer a home-like environment with the availability of social and recreational programming, group dining, entertainment, personal care, and other supports. Sometimes programs and services are available that respond to a person's religious, cultural, or linguistic preferences. Slide, please. To support providing the right care in the right place, changes have been made to the Fixing Long-Term Care Act and its regulation. To start, I want to highlight that these changes do not apply to current long-term care residents who may need to go to hospital for treatment. Also, the changes are grounded in a home-first philosophy that ensures that, whenever possible, patients arriving in a hospital are supported in returning to their home. But where this is not possible, the changes will facilitate the admission of eligible ALC patients into a long-term care home while they wait for their preferred home. They aim to support a new conversation between an ALC patient, hospital, and a placement coordinator about how and where a patient's needs can best be met outside of a hospital. They require that placement coordinators continually engage a patient, their family, and caregivers, and make every effort to obtain consent at each stage of the admissions process. However, if consent is not provided, the placement coordinator will be to move forward with the admissions process. This includes determining the patient's eligibility for long-term care, selecting homes that meet their care needs within certain geographic parameters, and authorizing their admission to a long-term care home. It does not authorize the physical transfer of a patient without their consent. As I mentioned, these changes are meant to support a new conversation to help ensure that people are receiving the care they need in an appropriate setting. That is why, at the very beginning of the process, a placement coordinator must provide a patient with information about long-term care. This information is intended to help ensure they are aware of the regular and the revised admissions processes and their options. Guidance has also been developed for placement coordinators to support effective conversations and help ensure people are appropriately matched with a long-term care home while they wait for their preferred home. When selecting long-term care homes, placement coordinators must consider a patient's care needs, accommodation requested, and the distance from the patient's preferred locations. Placement coordinators will also consider travel limitations for loved ones and caregivers, as well as a patient's religious, ethnic, and linguistic preferences. They will work with the patient to identify the locations where they prefer to live and will guide where the placement coordinator can select homes. Where a preferred location is not specified by a patient, their primary residence or the hospital where they're located will be used. A geographic parameter that uses a 70-kilometer radius from a patient's preferred location will be used across Ontario to select homes, except in the Northeast and Northwest regions where the radius will be 150 kilometers. In the North, when there's no long-term care home or there's limited vacancies within the 150-kilometer radius, a placement coordinator will be able to select the next closest long-term care home to the patient's preferred location that can meet their needs. If a home accepts an ALPC patient's admission, they will be placed on the existing long-stay waitlist in the crisis category for their homes selected by the placement coordinator and their preferred homes. Once admitted to a home selected by the placement coordinator, they will remain in the crisis category of the waitlist until they're placed in a preferred home. Where applicable, their place on a waitlist for a reunification priority access bed will be maintained to enable their reunification with a spouse or a partner in long-term care. If a patient prefers basic accommodation, but is admitted to preferred accommodation in a home not of their choice, they will be charged the basic rate until they are transferred to basic accommodation in that home or to their preferred home. They will also have the choice to stay in preferred accommodation and pay the appropriate preferred accommodation rate instead of being transferred. As I mentioned earlier, once admitted, they may be supported through an expansion of supports and services that are important to residents, their families, and caregivers. In closing, I'd like to repeat a few points that I mentioned earlier. First, the changes are grounded in a home-first philosophy that ensures that wherever possible, patients arriving in a hospital are supported in returning to their home. They also require that before any action is taken without consent, reasonable efforts are made to acquire consent. And the changes are supported by guidance for placement coordinators to facilitate their conversations with patients, their families, and their caregivers to ensure their preferences are considered. Next slide. The proposed changes will come into effect on September 21st, 2022. As we move forward, the ministry will continue to update long-term care residents, their families and caregivers, and is committed to responding to questions as they arrive. Thank you very much. I'm turning it back to Lori now for questions.
Thank you, Emily. That concludes the formal presentation for today's session. We wanted to preserve time to respond to questions that either came in advance to us or that have been received through the Q&A portion. And so I'm also going to invite Stephen, who is a resident representative. And Stephen, you've kindly agreed to help us out with this Q&A portion. I know some of the questions were received in advance over the previous few days. So Stephen, I'm going to turn it over to you to start with the pose of the first question.
Thank you. Thank you very much. My name is Stephen. I'm a resident at a long-term care home here in Hamilton. I've been a resident for 5 years now, and I'm the chairman of the resident council at my home here, and I've been so for 2 years, and I was an active participant the previous 3 years. So I have a few questions, and maybe they're not on my board here, but come up with this presentation. The first one is, you say you're opening up beds. Does that mean the old ward style rooms where there was 4 to a room? Thank you.
So it's Anita here again. So ward beds, 3rd and above beds will not be reopened. So that was communicated to long-term care homes recently that there will not be new admissions into rooms that already have 2 residents. We know that there are some homes who still have some residents in ward beds, and those residents can stay in those beds until they're discharged from the home. Thank you for that question.
Thank you. My next question is about ALCs. I have heard no mention of using retirement homes as an ALC. I'm just thinking of when I came out of the hospital, I ended up in a retirement home for a couple months until a spot came available for a long-term care. Is there any, there was no mention of that. Is that part of the plan?
Sure, I can answer that question. Not at this time. That's not a consideration at this time in terms of moving ALC patients into retirement homes.
Okay. Okay, just looking at the questions here. The next one is about getting 2 showers per week. Is there any way of monitoring to make sure that that is being done? And I know sometimes there's shorter staff and showers have to be canceled. Is there any way that the ministry monitors that?
Thanks for that question. So this is actually based in the legislation and regulations, and there are provisions there that are related to individual care needs, and that would include showering. And so every resident has a plan of care that includes their care needs. And this is for everything from medical needs, nursing needs, dietary, recreational, and other. And so the licensee of the home is required to ensure that a resident's plan of care includes all of those different components. And including showers, sorry, I just went up, including showers twice a week. So that is required for all residents in every home. And if if that is not happening, there are ways that you can speak to the licensee of the home, your nursing staff, and if you need to, you can also reach out to the ministry if you are concerned about that.
Okay, my concern is for the residents that can't speak for themselves, and maybe their family doesn't come in as quite as often as every week. So is there any way of monitoring that policy is being followed for people that can't speak for themselves?
So unless the ministry is aware of it, if we are doing proactive inspections in homes, and that includes talking privately with a number of residents in the home. So that could be a way that would be identified. But otherwise, we would hope that a resident or their family or caregiver would be able to provide that information if that was happening.
Okay.
Stephen, thank you for those great questions. I'm going to jump in and ask Lori to review a few questions that have come through the Q&A, and then we can come back to you if that's okay. But you've raised some great questions so far on behalf of residents. Stephen received some of the resident questions in advance, so he's asking on behalf of residents across the province. So thank you so much, Stephen. Lori, I'll hand things over to you for the next.
That's great.
Thank you.
Thanks, Melissa. And Stephen, thanks for those questions. They're certainly helpful to us. We'll give you a bit of pause so that you can get your next set lined up. We had a question, I'll address it briefly here, about when the regulations will come into effect. And so the regulations come into effect tomorrow. That's September 21st. And I'm going to move on to the next question, which I'll turn to Anita. Now, Anita, there's a question that if beds are being reopened, what is the plan for dealing with COVID outbreaks? And if there aren't beds for respiratory outbreaks, how will long-term care residents be protected?
Thanks, Lori. So homes certainly do have beds set aside or vacant for isolation purposes, if that's what's laid out in their emergency plan. So as of July of this year, homes needed to have a specific emergency management plan for all types of emergencies. And that could include, we know we have homes in the north who often have to do, there might be forest fires around, and so they have to relocate residents, but also for respiratory outbreaks, pandemic response. So depending on the layout of the home, they may or may not need to keep beds set aside for isolation purposes. So there's no longer a blanket requirement that every home has to have these beds set aside. In some cases, homes may have other rooms set aside, so not regular resident bedrooms, but they might have a therapy room set aside, or they might have other places that they would put residents who are experiencing respiratory outbreak or respiratory symptoms who need to be isolated. So it really is dependent upon the layout of the home, the types of rooms that they have, and then we have always encouraged homes to work with their local public health unit to determine what the best approach is for their home.
That's great. Thanks, Anita. We're getting lots of questions through the Q&A, so I really want to thank everyone. We're going to do our best to get to as many as we can. Before I turn it back to you, Stephen, we'll take one other question that's come in through the Q&A. And this one relates to funding. So I'm going to call on Abby to respond to the question about how much funding is being provided for additional supports and how do residents access this quickly?
I'm happy to provide some more details on that. So the three funding programs that I described, there is an additional $2.6 million for Baycrest Hospital to provide their virtual behavior medicine program that provides services to individuals with dementia or responsive behaviors. There is $20 million for a new local priorities fund that is administered by Ontario Health to help long-term care homes care for residents that have needs beyond their existing capabilities, as well as for residents who develop new medical needs. And in addition, there's an additional $5 million for Behavioral Supports Ontario to establish and expand current programs and purchase more therapeutic equipment and supplies to support new residents moving to long-term care homes. So two of those funds are administered by Ontario Health, and Baycrest Hospital is administering the third one.
Stephen, I'm going to turn it back to you. We're going to take a look at the questions that are continuing in the Q&A piece so that we can get our next ones lined up. But over to you, Stephen, for the next couple.
Thank you. The next question concerns Behavioral Supports of Ontario. Due to the current staffing crisis here in Hamilton, I don't think we've seen someone from Behavioral Supports in my home for about a year. Now, is this a problem in Ontario or just in the Hamilton area alone?
Stephen, I'm sorry, can you ask your question again?
Okay, this is about Behavioral Supports Ontario. We seem to have a shortage here in Ontario, in Hamilton. I'm just wondering, is there a plan to address that problem? For, I don't know if it's just Hamilton or if it's other parts of Ontario where we have a therapist or a PSW specifically trained in behavioral science.
So I can answer that question in terms of, as I mentioned, there is additional funding now available for Behavioral Supports Ontario. We understand that that money is going to be used to increase the number of staff, including converting part-time staff to full-time positions. So that should help in terms of increasing the access across the province.
All right, thanks, Abby. Stephen, I can pick up on a couple of questions that we've got here.
Go ahead.
So they've got a couple of questions. I think, Anita, they're coming back your way again. So the first one is with regards to where a resident is on a waiting list for another home, do they get bumped down on the wait list due to hospital placement moving in?
So the wait list is quite complicated in that the placement coordinator is always balancing trying to admit the person who has the highest needs into the home first. So it's really dependent on a specific scenario. So if there is a person in and I'm not sure if this is quite the right scenario, but if there's a person in the community who is waiting for a long-term care bed, and they're being weighed against somebody from the hospital, one of these ALC patients, if that person in the community is in crisis and their family is in crisis, they may be placed ahead of the ALC patient. So again, it's really dependent on the circumstance, the individuals being considered, and the placement into that particular home.
I've got another question that's going to come your way, and I know we've got lots of people on the call with us today. The question, Anita, is around what commitments being made to enhance home support so that people can go home first. And before you answer that, I really do want to encourage questions coming in from residents right across the province. We're very much looking forward to an opportunity tomorrow to connect with families, family members, and caregivers. So really encouraging questions coming forward today from residents as much as possible. So Anita, I'm going to turn it over to you for that question about home first.
Certainly. So Lori, at the beginning of the presentation, you talked about the 5 components of the plan that is being implemented by the Ministry of Health, Ministry of Long-Term Care, and Ontario Health. And one of the components there is really about finding resources and making more resources available at the community level so that if people want to, for people to be able to remain in their homes with the supports that they need. And so that is happening with our colleagues in those other areas. And then for our placement coordinators who work for home and community care support services, when a patient in hospital is no longer in need of acute hospital care, so when they're designated as alternate level of care, so requiring additional supports, they will look to try and place them home first with those community supports. And then if the determination is made that another location is more suitable, so for example, long-term care, then they will work to place them in the most appropriate long-term care home that meets their needs, both care needs and other needs, so spiritual needs, location, those types of things would be considered as well.
All right, thanks very much, Anita. Again, we're getting lots of questions in. Stephen, I'm going to turn it over to you while we line up our next questions on our end.
Okay, the next question is is information being made available to people waiting in AL or in hospitals about the homes they would like to go in terms of the waiting list? And information on other homes that may be available in the area?
Yeah, I think I can answer this one, Stephen. Thank you. Yes, as part of the process that placement coordinators are going to be undertaking when they're working with ALC patients, it's going to be an ongoing conversation with the patient and with their families and caregivers as appropriate. And they're going to be speaking with that patient about where there might be homes with shorter wait lists or with availability that might meet that patient's needs. And talk to them about, what homes might be close to a preferred location, whether it's their home address or, a loved one or relative's address. So they'll be providing that information to those patients about the homes that they might want to, might consider in terms of a temporary placement while they're waiting for something more permanent in a preferred home.
The next question would be for people that are waiting in the hospital. Will the placement coordinator tell them that if they're on or off, or on, I should say, a crisis list, which puts them at the top of the waiting list? And if they're not, then are they being advised they may have to wait a while and they may end up in an ALC?
I think if I understand the question correctly, yes, there's an expectation that a placement coordinator is communicating clearly with that ALC patient from the very beginning about what the regular process is in terms of admissions, where an individual would select their preferred homes and waitlist for them, but also explain to them this new process that's in place where an individual would be temporarily placed in a long-term care home while they wait for one of their preferred homes. So they're going to be providing that information. And I think like you've articulated there, they may say things, like your preferred home has a very long wait list. Can we look at some options that are, close to where your daughter lives, close to your home address, that could meet your needs and meet your care needs and might be appropriate in the short term while you wait for that longer on that longer list for a preferred home. And in terms of priority on the wait list, I think Anita spoke to this, but if an individual, an ALC patient, is placed in a home temporarily that's selected by their placement coordinator, they will be placed in the crisis category of the wait list for their preferred homes. So that would mean that they would be prioritized for entrance in those preferred homes, and they'd remain on the crisis wait list until they enter one of those preferred.
Thank you. This might be a question outside of what we're doing here, but people with psychiatric diagnosis that end up in an ALC, are they going to be funneled specifically to an ALC that can handle the problem?
I can
So
answer.
excuse, go ahead.
Oh, I was just going to say, I mean, the normal, eligibility process and assessment process still applies in a scenario, in the sense that a placement coordinator needs to determine the eligibility of that patient for long-term care and determine that long-term care is an appropriate setting. And then also look at the care needs of that individual. And a home, when they provide the information to the home would have to accept that admission, would have to state that they could meet the care needs of that individual. So the safety of both that patient and then the other residents would be paramount in terms of the appropriateness of the selection of that home for that individual.
Okay, thank you. I'll turn it over to the question and answer board there.
All right, great. Thanks so much, Stephen. The next question is going to be for Christine. Christine, we've got a question about when the ministry is going to lift the restrictions in long-term care and provide residents the same right to live as those in the community. And Christine, I'm going to turn it over to you to respond.
Thank you, Lori, and thank you for the question. I know it's been challenging on residents to have to live through with the restrictions that have been placed on homes to kind of protect the health and safety of residents and caregivers and staff in the homes over the course of the past 2.5 years. There have been a number of measures that have been lifted, so residents can leave the home on a social absence, they can receive visitors. So a number of measures have been lifted over the course of the past several months, but there are still some in place to continue to protect the health and safety of folks living and working in long-term care homes, such as testing and screening and masking. As I noted earlier, we are currently working with the Office of the Chief Medical Officer of Health to assess all of the current measures that are in place to see what makes sense in the current context, recognizing there's high vaccination uptake in homes, but also in the community, access to therapeutics. So it is something we're actively looking at, all the remaining measures, to see what makes sense at this point in time. So we hope to have an update shortly on that. It is kind of active conversations based on current evidence and what we're expecting to see, because we also need to balance that with ensuring health and safety based on what we're expecting to see over the coming months with the flu and COVID kind of season upon us. Thank you, Lori.
Again, we're getting lots of questions. Some are connected directly to the topic we're addressing today, but there's one here, Abby, I'm hoping you might be able to address a very specific question about residents and funding for supplements like vitamins, and I was hoping you could respond.
Yes, I think the question was, is there funding available for supplements like vitamins? And the answer is yes. The ministry provides funding for nutritional support, which covers food and also vitamins or supplements.
All right, thanks, Abby. Stephen, I'm going to turn it back to you for some of those questions we received in advance.
Okay. With the lockdowns, and I've been recently one, is the people that are left in their rooms, is there any extra support for people that, let's say, have Parkinson's and cannot move in their wheelchair and are left in their room because we're all in lockdown? Is there any extra support for them, other than being left in their room 24 hours a day and maybe having a visit at meal times only?
I can answer that one. Thank you for the question, Stephen. So when there's, I'm assuming your home was maybe in an outbreak, and that's why they've had residents in isolation. So in an outbreak, the home will be working closely with their local public health unit on kind of what makes sense in the home and how long residents will need to be isolated for. Where it's possible, homes are encouraged to assist residents with taking walks, one-on-one in a hallway, just to ensure safety of all residents. So there are opportunities to support residents, but again, homes will be working closely with their local public health unit on what makes sense in the context of that home and with that specific outbreak.
Okay, thank you. This new booster that's coming out, does it protect us against the new variants beyond Omicron?
So
the B and the C and the D and the E.
So the current vaccines that are available, so protects against the original kind of COVID strain, which was really effective against Delta, which we experienced kind of last year. And it's also now targeting the Omicron variant and some of its subvariants. So clinical studies have shown that it has been effective against both kind of the former strains, including Delta, and the current kind of Omicron one, which is the current one that's circulating in Ontario and its kind of sub strains. So you might have heard like BA1, BA2. What we don't know, though, is if there might be a new variant that might come out. There aren't any signals of that right now that we're monitoring. But of course, we would have to that's a bit of a wait and see if there's any new variant that we're not yet aware of and the effectiveness of the vaccine against that variant.
I'd be very interested in that because we've just been 3 weeks in a lockdown here.
Oh,
So-
sorry to hear that. I hope, are you out now? Is the
No,
outbreak over?
not, we still got 2 that are in isolation, so we're still in lockdown, but we're allowed to be out in our home area. We just can't go outside or the lobby. We have to stay in our home area and we're encouraged to stay in our rooms.
Right. Okay, well, hopefully that outbreak will end soon for you.
Okay. I'll turn it over to the Q&A again, please.
All right, thanks very much, Stephen. I'm picking up on a question here that cycles back to isolation beds and how those form a part of pandemic planning historically. So the question is, can we get clarification because some areas have received information from local placement coordinators and have been instructed to fill beds despite pandemic plans. And so I think that that's a question for Christine or Anita.
I can answer that. So the placement coordinator's responsibility is for for facilitating admission into long-term care homes. So they are to understand what beds the home has available, and then finding the appropriate resident to fill that bed based on all of the different priorities that they have to consider during that placement process. So the home is responsible for their pandemic plans, including isolation purposes. And I saw a question saying that homes were advised to open all isolation beds. So not all isolation beds, only isolation beds. So many homes don't need isolation beds. For example, homes who have only single resident bedrooms, they don't need to keep isolation beds available. So we have a number of homes who don't need them at all, but then homes have to, whatever their plan is, they have to identify which beds they may need to keep held open, vacant for isolation purposes. So I think there are different accountabilities. The placement coordinator's role is to help facilitate admission of a resident into a home, and then the home is responsible for having their isolation plans for pandemic-related purposes or respiratory outbreak or those types of purposes as well. More information will be provided to long-term care homes, to the licensees in the near future related to funding associated with those beds. So more information to come for homes.
We've had another question that's come in that I think is an important one and likely on the minds of many people attending today. This question reads, my home is very short-staffed and relying heavily on agency staff. I feel my care has been compromised as a result. How can my home safely accommodate additional admissions requiring heavier care? Can my home decline a new admission on the basis of our staffing crisis? And I think I've got a few colleagues that may have different perspective on how to respond to this. So I'm going to turn first to Anita.
Thanks, Lori. So yeah, it's very important that when a home is accepting a new resident, that they have sufficient staff to help care for that resident. And so that's a really important consideration when new admissions are being made to long-term care homes. We recognize that there is a staffing shortage in long-term care as well as like the broader health sector. So lots of work is being done on in that area. So I'm going to hand it over to my colleague, Erin, who can provide a little bit more information on that front.
Thanks, Anita. Just to add, as you may be aware, in December of 2020, the government launched a Better Place to Live A Better Place to Work Ontario's long-term care staffing plan, or the staffing plan as we like to call it. And it sets out actions to hire more staff, improve working conditions, etc. And I just wanted to mention at the center of the plan is increasing the hours of direct care provided by nurses and personal support workers to a provincial average of 4 hours per resident per day. And so I think, as mentioned earlier in the presentation, to support this plan, the government is investing $4.9 billion over 4 years in order to create over 27,000 new full-time positions for nurses and PSWs in long-term care. In last fiscal year, we did invest up to $270 million in additional funds for this year as well, up to $673. And there'll be additional funding provided for the next coming years as well. So I hope that answers the question. Thank you.
Thank you, Erin. We've got about 5 minutes left. And so, Stephen, I'm going to turn to you for one last question before we close out our webinar today. So over to you, Stephen.
Oh, I had 2 questions, so it's going to be hard to pick between the 2. Yeah, this one involves the quality improvement plans that all homes are supposed to post on their webpage. Are the placement coordinators making the people available in ALCs and families aware of these quality improvement plans that each LTC home should have posted on their webpage?
Sorry, I'm just trying to get my video going. That's a great question, Stephen. And actually, I work on some of those quality files, so I can speak to that a bit. Yes, there is a requirement for long-term care homes to post their quality improvement reports, which is slightly different from the quality improvement plan, which is an Ontario Health document. Nonetheless, I think it's an excellent point in the sense that the purpose of posting those quality improvement reports is to give some transparency and give residents, caregivers, members of the public information about what's happening in homes, what their commitment to quality is, what kind of initiatives they're undertaking. So I will say, I don't think we've contemplated at this point directing placement coordinators to specifically direct ALC patients and their families to looking at those reports, but I think it's a good flag for us that we could take back because we certainly are encouraging placement coordinators to provide ALC patients and their families with as much information as possible about homes and about homes that might meet their needs. And that would be an important source of information, I think, for patients and their families in terms of evaluating different homes. So I'd say thank you for the question, and we could take that back and try to make that connection.
Thank you.
Thank you, Emily. I want to thank everyone for spending this time with us this morning. We're certainly cognizant of the impacts that COVID-19 has had on all residents, all of you in your homes, in your communities. It continues to do so. And we really appreciate you taking the time to meet with us today. We're certainly going to continue to work hard to update you as we move through the fall. And if you have any further questions following today's session, please don't hesitate to reach out to us. We've got our email address on the screen right now. We'll also be sharing this deck with the Ontario Association of Residents Councils, and so you'll be able to access this after the session today. And again, my thanks to all of my colleagues who've joined today to respond to questions, to all of you for joining, and to the Ontario Association for Residents Councils for their support in coordinating this today. Melissa, any closing comments from you?
Thank you so much, Lori. You took some words right out of my mouth in terms of acknowledging our panelists today, including Stephen, who bravely kind of brought some of the resident questions and concerns to the forefront. I thought this was very special to have a resident on our panel. We look forward to continuing to work with our ministry partners to really prioritize and amplify resident voices and their lived experience, and through our work with government to really incorporate this invaluable feedback into policy and practice as we move forward. I wanted to encourage residents who've tuned in today, continue to reach out to us at OARC to support you so we can provide tailored support and education. We also love coming together with you every Thursday at 2 o'clock for our resident forums. That's how we really hear from you, how things are working, what are some of the challenges, and working together to come up with some solutions that are really resident driven. So please continue to keep in touch with your OARC team. And as our ministry partners have generously shared their contact information, if there's something that maybe wasn't covered within the scope of this session, you can reach out for clarification via the email there. Thank you so much, everyone, for tuning in today. And we look forward to continuing this conversation. Have a great day and take care.